I'm the team leader dental hygienist here at Reflections Dental Care. Dr. Bacchus introduced me to Myobrace and what it can do for patients a couple of years ago. I'm really excited about it, about offering it for patients. My son Parker is starting his Myobrace treatment at the end of this week, and I'm really excited to see the results that we're going to get from him. I first noticed, after listening to Dr. Bacchus talk to other patients, I noticed he breathes through his mouth a lot, and even when he's just sitting watching TV or listening to someone talk or just watching something happen, his mouth is just open and his little lips are parted. And it got me thinking about the education Dr. Bacchus was giving our patients about Myobrace and how everything plays together with breathing and the mouth development and the facial development and how it affects the kids long term, not just while they're little with their baby teeth. So I have a lot of questions myself since he's getting ready to start treatment, and so we have some frequently asked questions to go through with everyone. First one is, how long does treatment usually take?
It usually takes about 2 to 4 years. It really depends on when the Myobrace treatment is started, but there are typically 3 to 4 stages of the treatment with the Myobrace. The first being habit correction, so like what Nicole was talking about with Parker, breathing with his mouth open is a habit that we want to change and correct. We want to turn it into breathing with his mouth closed, his lips together, his tongue on the end spot, and that will really help to facilitate with the proper growth. The next thing would be arch development, and then dental alignment, and after that, a form of retention.
Another question is, how often are Myobrace appointments and how long do they usually take?
That's a really good question. I'm a busy mom myself, and adding another thing to the to-do list can be concerning. However, we see your child once a month for a Myobrace appointment, and they're usually really quick, 20 minutes or less, and so it won't cause a burden to your schedule.
So I know that kids do 1 exercise a month. How long do the exercises usually take for them to do?
That's a really great question. So the exercises are very important because they can help to retrain those muscles that are having an issue. And so the exercises, though, are not these hour-long type of exercises. They are simply 2 minutes a day, twice a day. So they're very doable and they don't require a whole lot of time.
How do we help our children find the time to wear the Myobrace each day?
Yes. Getting that hour a day in is very important to the success of the treatment, because during that daytime wear, we are actively training your children's muscles to help them achieve really great results. So getting that hour in takes a little bit of creativity, but it's pretty easy to do. So suggestions that I like to give my patients are to do that hour during TV time. If you allow your children to watch TV, that's a great time and a great reward for wearing your Myobrace. Also, when you're running errands, have your Myobrace in the car, and you can have them put the Myobrace in on the way to the errand, like school, and then on the way home, put their Myobrace back in. Something else is that the hour does not have to be consecutive. So you can do 20 minutes here and 20 minutes there. As long as it adds up to an hour, it's doing what it needs to do.
And how quickly will we see results?
So the exciting thing is that I have seen results in as quickly as 3 months in some patients. My son is actually going through Myobrace right now, and I have seen amazing results in him in just 3 months. He started out with a really deep bite. So that means that his upper front teeth were completely covering his lower front teeth. So when he smiled, you could not see his lower incisors at all. And the problem with this is that that deep bite is going to cause him to grow more long and narrow rather than out and wide. And so with just 3 months of wear and the exercises, his bite has now opened up. You can see some of his lower incisors. Also, he's developed nice spaces in between his baby teeth, and this will help to facilitate more room for his permanent teeth.
That is a question a lot of people ask. Should they have spaces or not?
Yes. Children should have spaces in between their baby teeth. In fact, if children's teeth don't have spaces, it's considered crowded, which you wouldn't typically think that because they are nice and lined up. But if they don't have those spaces, their teeth are crowded.
Okay. This is a big question I have because I am curious to see how my son's going to do with it, but I'm afraid he may have trouble sleeping in the appliance, in the Myobrace, overnight.
So lots of parents have this concern, and I will say that a lot of them are pleasantly surprised that their child will take to it right away and make it through the night with no problem. However, others do take longer, and that's not concerning. We really would like to see your child wearing it through the night, every night at about the 3-month mark. So it's okay if it takes a little bit of time, because we're retraining things and forming new healthy habits.